Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the January 12th, 2022 update from the Dubuque County Public Health Incident Management Team. Dubuque County and the entire state of Iowa and the rest of the country continue at high transmission for COVID-19 with 909 cases, yes, that's 909 cases reported in the last 7 days. That's a huge increase from the totals I reported at the end of December, which was around 305 cases in 7 days. Yep, we're starting off 2022 with a big increase, and these cases are primarily due to the Omicron COVID-19 variant, which, like all the other variants, developed because of the continued worldwide high transmission of COVID-19, which stems from lack of immunity or waning immunity. Right now, Omicron is surging. An estimated 100% of Dubuque County positive tests are Omicron, and 76% of the positive cases in Iowa are Omicron. So in other words, it's going to be a long month, as if January doesn't seem to go on forever anyway. For the next few weeks, we all really have to stay away from crowded public events, retailers, and other gathering venues. Not to mention staying home when you're sick with anything, whether it's a cold, stomach flu or norovirus, influenza symptoms, etc. And by the way, all of these have COVID-19 symptoms. So even if your respiratory or cold symptoms are mild, it's best to get tested. The incident management team keeps the city and county website updated with testing that's available in the community. Not all tests give you results right away, but if you're sick or symptomatic, you should stay home anyway, so waiting for a test result shouldn't be a big deal. Speaking of testing, let's try and review the whole testing scene. You have at-home, PCR, lateral flow, rapid, antigen, reportable, nuclear, saliva, nasal, oral, nasopharynx, antibody, BinaxNOW, Test Iowa, etc., etc. What does it all mean? Add in science and research, politics, policies, supply chain, and the economy, and we have one hot mess. Or maybe I should say situation. Anyway, here's what you need to know. If you have COVID symptoms, even if you've already had COVID or if you're vaccinated, isolate or stay at home and away from others and get tested. Which test should you get? If you're mildly ill or have been exposed but don't have symptoms, the free test sites or Test Iowa take-home kits are a good way to go. If your symptoms are worsening, persistent, or causing you to feel really ill, you could do an at-home test kit purchased at a retail store, or be tested by a healthcare provider, or do Test Iowa or one of the free testing options. Healthcare providers will use rapid tests if they have enough supplies, but they'll also use PCR tests, which are by far the most reliable at detecting the virus, but these also take longer for results. Test Iowa mail-in kits are also the reliable PCR test. What's that? You have mild symptoms or were around someone with COVID and you want a rapid or fast result? Okay, you can go to one of the free test sites in town or purchase a rapid at-home test kit. However, if you use one of those test kits while you have mild or no symptoms, you may get a false negative, which means you really are positive and that rapid antigen test didn't pick up the virus in your body. The virus will probably show up in a couple days on a rapid test, which is why we recommend testing 3 to 5 days after exposure. As a reminder, CDC shortened the recommended time for isolation from 10 days for people with COVID-19 to 5 days, if they're asymptomatic, followed by 5 days of wearing a mask when around others. Therefore, people who test positive should isolate for 5 days, stay home, and if at the end of those 5 days you don't have symptoms, they may leave isolation if and only if they can continue to wear a mask for 5 days to minimize the risk of infecting others. This guidance also follows for if you've been exposed to a COVID-19 case. For people who are unvaccinated or not boosted, CDC now recommends quarantine, which requires you to stay home for 5 days, followed by strict mask use for an additional 5 days. If you are fully vaccinated and have received your booster shot, you do not need to quarantine following an exposure, but should wear a mask for 10 days after the exposure. For anyone, if symptoms occur, you should immediately quarantine or stay at home until you have test results, showing that the symptoms are not due to COVID-19. For anyone exposed, it's recommended to get a COVID-19 test at day 5 after exposure. So you probably just caught that the recommendations for quarantine are different for those who are fully vaccinated and those who are also boosted. Boosted is better described as up to date, meaning you've received the 3rd dose of Moderna or Pfizer or the 2nd dose of J&J. Those who are up to date have the highest level of protection from COVID-19, which also means you have a far less chance of landing in the hospital or dying from COVID. And speaking of those in the hospital, just to add to your data overload, right now in Dubuque County, 75% of the hospitalized COVID-19 patients are unvaccinated. I'm just saying. I know there's a lot of numbers and statistics out there, and sometimes the more you see, the more data you want. Currently, the situation all boils down to this. A lot of virus is spreading in Dubuque County. Many people do not know how or where they became infected with COVID-19. There's also a lot of different respiratory illnesses being passed around, so get tested for COVID and see your doctor if symptoms worsen. Stay home when you're sick. Get vaccinated. Pick out some good movies to watch at home this weekend. And maybe, just maybe, this will be the end of the beginning of this pandemic. Stay safe, everyone, and thanks for tuning in.